This 82-year-old female patient was referred to us for endodontic retreatment of tooth number 18 and root canal treatment of this calcified, as you can see, extremely calcified mesial. Look at the mesial canals there. Calcified tooth number 19. Tooth number 19 had a porcelain crown on it. Again, you can see calcified canals, no pulp chamber, periapical lucency here. Tooth number 18, the root canal was done a few years ago. There's a temporary crown on the tooth. Patient will be getting a new crown by her dentist. Root canal, as I said, was done a few years ago. You can see a periapical lucency here and here, and patient has symptoms. Both teeth were tender to percussion and palpation. Probings were 2 to 3 millimeters all around, and we discussed the radiographs. And again, patient had symptoms. This patient had severe gag reflex, so we had to sedate her for the x-rays today, x-rays and treatment. Severe gag reflex, and on top of that, as I said, she was 82 years old and she had severe dental phobia. So today we went ahead and sedated her and did endodontic treatment of tooth number 19 and endodontic retreatment of tooth number 18, both together, of course, in one appointment under IV sedation. Tooth number 18, these darn things were plastic thermophil carriers. And right here was a fiber post. These were very difficult to remove, these plastic thermophil carriers. As you can see here, the canals were under prepped. And when you under prep a canal, and the canal is under prepped, so there's no shape to the canal, there's no flare to the canal. So as the clinician inserts these plastic thermophil carriers that are wrapped, sandwiched in gutta percha, the plastic is the core, and then the gutta percha wrapped around the core, the plastic core, and it gets heated up. And then they insert it, they strip the gutta percha as they're inserting it into the canal, so there's no space, so all the gutta percha comes out. They don't know how to use this material. So the gutta percha all gets stripped off of these plastic cores, and the canals end up getting filled with these plastic cores alone. So when someone like me, an endodontist, wants to remove them, there is no space. There's no space between these plastic cores and canal walls. If these material were used properly, they'd be gutta percha, right? But when there's no gutta percha, that means that now removing this material is extremely difficult. They're usually wedged in as well with force. All right, so very difficult to remove them, but we were able to remove them. And here they are. Remove the two mesials. These are the two mesials, and distal, part of it came out, and part of it I just could not remove, so I had to bypass it, and I bypassed the apical few millimeters part of this plastic thermophil carrier. I used ultrasonics to go through the fiber post there, and took me a while to locate the mesiobuccal and mesiolingual of the palatal of number 19. I'm sorry, mesiobuccal and mesiolingual of tooth number 19, because of, as you can see, calcification of the canals. And take a look here. And here it is. As you can see, everything went beautifully. Tooth number 18, as you can see. Now we created the proper flare, taper for these canals, as you can see. And look at tooth number 19, two completely separate roots, mesiobuccal, mesiolingual, and two distal canals that join apically. Everything went great, as you can see. Patient did very well under IV sedation, and endodontic retreatment of tooth number 18 and root canal treatment of tooth number 19 both completed. Patient will see her dentist to have both teeth permanently restored.